never do CPR because you would be circulating the blood and the blood would go right out of the hole. So the first thing to do is to put pressure on the wound. That was too late. I checked his pulse.
Are all causes of cardiac arrest the same? Absolutely not. Should you be performing pre-hospital CPR in patients who are victims of a traumatic full arrest? Maybe? Following a medical cardiac arrest, which is usually due to an underlying cardiac event, whether that be an MI or a fatal arrhythmia, CPR is performed to maintain some semblance of perfusion until the underlying pathophysiology, which is usually cardiac dysfunction, can be reversed. Following a traumatic cardiac arrest, most of these patients die due to severe preload deficit due to exsanguination or bleeding, tension pneumothorax, cardiac tamponade. They may have loss of airway with severe hypoxia or a severe devastating injury with loss of airway reflex. And the fact of the matter is there is no data to support the use of CPR in trauma patients in cardiac arrest who have evidence of exsanguination. And in such cases, it may help to just take a step back and ask yourself to wait. What am I treating? Now I get it. We all want to be helpful. It's better to do something rather than nothing. But if you're applying CPR to a patient who's hypovolemic, all you're doing is pumping an empty heart. And if you're performing CPR on a patient who is exsanguinating, you may actually be hindering other efforts that could save that patient's life. And as you heard in this video, one of the first things you want to do is identify and stop the bleeding. Apply pressure, pack the wound, or apply a tourniquet in the case of an extremity injury. Other key interventions include establishing high flow lines, securing a definitive airway, and potentially performing bilateral finger thoracostomies or needle decompression. With all that said, in this 1999 study out of UC Davis in Sacramento, they found that trauma patients who were pulseless in PEA or had a heart rate less than 40 beats per minute had a 0 chance of survival. And even better than feeling for pulses is the use of FAST. In this prospective study, if both cardiac activity and pericardial fluid were absent, the chances of survival following resuscitative thoracotomy were 0. With all that said, there are 2 times where one might consider performing out-of-hospital CPR for a traumatic cardiac arrest. That is following blunt trauma where a medical condition may have resulted in the cardiac arrest, for example, a massive MI while driving a car and then getting into an MVC, or in patients with penetrating torsal trauma with known cardiac comorbidities. Unfortunately, among victims of penetrating trauma like takeoff who are in cardiac arrest, there's really no role for CPR in the pre-hospital setting. Like and follow for more.